Good morning, students. Welcome back to our YouTube channel, dEnTeZy. Let's make dentistry easy with dEnTeZy. Continuing the orthodontic lectures, today we are going to discuss about the types of orthodontic forces. There are certain set of forces which are being used in orthodontics to bring about certain tooth movement. So today in this lecture, we'll discuss about what kind of forces are being used in case of orthodontics. So before jumping into the types of forces, first of all, we should know what a force means. Whenever an object or a body tends to change the position or motion, shape or structure, so that particular thing which tends to change the shape, structure or motion of a body is called as the force. Now, as we know, according to Profit, the orthodontic forces has been divided into three parts. One is the continuous force, interrupted force, and the intermittent force, based upon the duration, which means the time for which the force is being applied, and the rate of decay. Now, what basically rate of decay means? Rate of decay means whenever a force is applied onto the tooth using various orthodontic appliances. Could it be the fixed or removable or orthopedic appliances? So that very force, after the force application, there is some fall or decline into the level of forces which are being applied. So that is called as rate of decay. Decay means there is a decrease in the amount of initial level of forces being applied. Now, let's discuss each force one by one, starting with the continuous forces. In continuous forces, the active forces they decreases little in magnitude between the appointments. Supposedly, there is a patient who visits the orthodontic clinic on the 5th of June, and the next visit is nearly about 1 to 5th of July, approximately between the 20 days duration. So between the appointments, the level of active force decreases little bit. So that is the active forces, and the force decay is only fraction of the original. There is a very little decay into the force. And there is an important thing which is important here is the resorption pattern. In continuous forces, there is the direct frontal resorption. Now, to summarize what frontal resorption is, supposedly this is the crown portion of the tooth, this is the root portion, alveolar bone, and here are the green one are the PDL fibers. Now, whenever external orthodontic force is applied onto the tooth structure, it could be heavy forces or it could be the light forces. Here we'll discuss about the light continuous forces. So whenever a force is applied to the tooth structure, what happens is there is compression of PDL fibers. There are two sides. The side on which the force is being applied is the tension side, and the another side opposite to the tension side is called as the pressure side. On the tension side, there is a stretch in the PDL fibers. The PDL fibers they stretch out, whereas on the pressure side, there is a compression of the PDL fibers. In light continuous forces, the PDL fibers are compressed, but there is no occlusion of the blood vessels. The blood vessels are not completely occluded, hence the blood supply is intact and blood supply is maintained, which leads to the osteoclastic activity. Osteoclastic and osteoblastic activity in the tension and the pressure side of the tooth. On the pressure side, the osteoclastic activity is there, which leads to the bone resorption, and on the tension side, there is the bone deposition, which ultimately lead to the tooth movement in the direction of the pressure side. So in that particular case, there is the resorption. So that is the frontal resorption. The resorption is on the front side. Now, for the very quick orthodontic tooth movement, the frontal resorption is preferred, and it is done with the help of light continuous forces, such as in case of light wire appliance system. So, light continuous forces, these are the most favorable kind of forces for the orthodontic tooth movement. Now we'll look at the graph. If we plot a graph between force and the time, what we see is this yellow color depicts the force levels, the original force levels. So whenever a force system is applied onto the tooth, there's a slight decay in the force levels, but which is very slight. Once and up at the time of appointment, it is reactivated and it is maintained at its original level. Original force level is maintained. So we can say that the rate of decay is the fraction of the initial force levels. Now coming to the interrupted forces. In the interrupted forces, as the name suggests, the forces are being interrupted in between the appointments. What does it mean? The force level they declines to zero between the activations. As we saw in the previous ones, the force level never declined to zero. But in case of interrupted forces, the force level declines to zero. Initially, the forces being applied, they are very high, but later on it decreases over time to zero. As we discussed about the light continuous forces in case of continuous force system, but here there is the in that case the resorption is frontal in nature, but here since the heavy forces are applied, so the resorption is undermining in nature. Initially the forces are high, but later on it declines to zero. So in that time, it gives the time for the tissues to recover. Now, what is the undermining resorption? As we saw in the previous case, the forces applied, they were light. But here, the forces applied to the tooth, they are heavy. There is one tension side, there is one pressure side. In case of pressure side, as we know, there is osteoclastic and osteoblastic activity. In case of pressure side here, the PDL is so much compressed that it leads to crushing or the occlusion of the blood vessels. Once the blood vessels they are crushed on the sides of the on the pressure side, so there are aggressive changes are seen which leads to hyalanization. We study the biology of tooth movement. There we'll discuss about the hyalinization. So once the hyalinized areas are produced, so it takes longer time of duration to recover back to the normal and lead to the tooth movement. That is why the heavy orthodontic forces are never recommended for the ortho. If we look at the graph which is being plotted between the force and the time, there is one uh, original force levels, and whenever between the appointments, the force level declines to zero. So again, the appliance is being worn or activated, and the force level later on declines to zero whenever the patient when between the appointments. Next is the intermittent forces. The force level there also they declines to zero, but intermittently. Now, orthodontic appliances, when the appliances are being removed by the patient. Now, the orthodontic appliance removed by the patient. So, it is said that intermittent forces they fall to zero when the appliance is taken out and only to resume when the appliance is reinserted into the oral cavity. The forces also decay as the tooth movement occurs. Initially, here also the force levels are high, but later on they decline. Here also the force levels are high and hence there is undermining resorption. And if we plot a graph between the force and the time, there is removal of the appliance. At that time, there is decline into the force levels. But when the patient reinsert the appliance, at that time the force levels they are maintained to the original. Always remember the intermittent forces produced by produced by all patient-activated appliances such as elastics, removable plates, headgears. So the forces generated during the normal function or chewing, speaking, they can also be viewed as a special case of intermittently applied forces. So this was all about the types of orthodontic forces, which is a very easy topic. And thanks for watching. Please like, share, and subscribe.